Welcome to this episode of MoveMint Medicine podcast. Thank you to those who have tuned in to previous episodes. Please continue to share with your friends, your family, and your colleagues. And if you have any questions, please remember to post those either on Facebook or on YouTube, and we'll happily address the comments or questions in future episodes. We thank our partners for the podcast. So it's the Fit India Movement, the Back to Fitness Clinic, which is the clinic that Rajat runs, La Ultra The High, which is the race that Rajat puts together in Ladakh, and also the Moving Mountains Within Film, which is the film about the 10th edition of La Ultra The High. So I'll pass over to my co-host who will introduce today's guest. So over to you, Rajat.
Thank you, Darren. And thank you, folks, for watching MoveMint Medicine podcast. And today we have a special guest, Dr. Amish Vora. Dr. Vora, just get on with your academic and your professional background, please.
Hi, Rajat and Darren. Thank you for inviting me for this podcast. And congratulations to both of you. This is a wonderful activity which you people are doing, especially during this pandemic days when people are lost what to do. Going over to my background, I'm Dr. Amish Vora. I'm a medical oncologist by profession. I did my MBBS and MD in Mumbai from Mumbai University. And then I did my DM in medical oncology from All India Institute of Medical Sciences, New Delhi. After that, I was in Tata Memorial Hospital, Mumbai for 6 years. From there, again, I switched my gears, came to Delhi. I did research in oncology and neurology for 2 years. Again, came back to clinical practice. I was in Max Hospital, Saket for 6 years. And last 2.5 years, I have started my own center for treatment of cancer called HOPE, H-O-P-E. Actually, it stands for Holistic Oncology with Patient Empathy. And Rajat, you have come there a couple of times. We try to treat cancer in a holistic way. And of course, exercise remains one of the main aspects of treating cancer patients. Avni Vora, my wife, whom Rajat knows very well, is in charge of Exercise Reduces Cancer program. And Rajat, you were the pioneer. You started this program in HOPE, and Avni is carrying it forward. What we do is we try to explain the importance of exercise to all cancer patients who come to HOPE. Try to give them some basic exercise, some advanced exercise based on where they are in terms of their mobility, their stability, their stage of disease, and try to increase the performance and quality of life. So that is where I stand today, Rajat.
That's absolutely incredible. It sounds like a fantastic program. You're doing a really, really good job with that. I just wonder whether you could tell the audience about your personal fitness journey. So have you always been active? Do you run?
Very interesting question, and thanks, Darren, for asking that question. I was a great sports person during school days. I used to play volleyball, I used to play cricket, I used to play table tennis. There was not a single day which was without any practice. This went on till MBBS days. I was one of the team member in cricket team of KEM Hospital, Mumbai, where I did my MBBS from. During MD, I think I lost out. I stopped exercising, and after I got married to Avni, and once she became pregnant, I enjoyed sympathetic weight gain along with her. She went back to her fitness program after the pregnancy. I did not go back. And in fact, I started gaining weight. And there was a point of time when I realized that climbing 2 stairs, I was breathless. And that is a time I think I decided that I need to go back to my journey. And I again sought my wife's help. She started helping me with the exercise. She used to run marathons regularly. She was an aerobic fitness trainer, marathon fitness trainer, ACSM certified. Meantime, what happened, there was one patient in Max Hospital who needed some money for the treatment, and they would not go to government hospital for treatment. And that is the time I decided to run Mumbai Marathon to raise funds for that child. And the world was amazing. We raised 6 lakh rupees in 12 days flat. I started running marathons since then. I have ran 4 marathons since then. I do regular exercise. Again, I falter in between. And whenever I have backache, I go running to Rajat and I again tell him, oh, am I going to run this marathon or not? And again, he would stress the importance of regular exercise. So I've been doing exercise. I understand the importance of exercise, especially last 4 to 5 years. 3 days a week, definitely I'm doing exercise right now, Darren.
During this lockdown period, we were talking about earlier about the cross training that you've been doing. So please enlighten us about that.
So during the lockdown, every day morning, jhadu pocha or cleaning the house is my responsibility. Now, which part of the muscle am I training myself for, whether it is called cross training or not, we don't know. But I'll tell you a very interesting story, Rajat and Darren. Rajat will be knowing, Darren, olden days, during the 7th month of pregnancy, normally what used to happen in the household, they would get rid of the maid and the pregnant lady is supposed to clean the house. So when you bend forward and you're cleaning the house, the natural push down of the baby happens, and 99% of the times you have a natural and normal delivery. And this is a well proven fact amongst the rural part of India. So I think that is what the cross training Rajat is referring to, and that is what I have been doing every day for the lockdown period. I have been doing yoga plus exercise 5 times a week at least. I have a yoga teacher who goes on WhatsApp video call with me, and we try to do. In fact, I did the frog position for the first time in my life, and I did Sirsasana for the second time in my life, and I'm enjoying that.
Fantastic. I think there is an opportunity during this lockdown period to sort of engage in activities that we wouldn't normally do. So, yeah, exactly. The ability to actually do yoga and improve upon things or even develop new sort of behavior patterns as well is really important. I just wonder whether we could go back to what you were saying about the exercise for cancer patients. So are there any particular types of exercise that are suitable for certain types of cancers versus other types?
Darren, thanks for asking that question. I cannot say the importance of exercise before, during, and after cancer treatment in the words which I can't describe. So I'll start with what evidence we have. National Cancer Institute, Bethesda, USA, had done a study of 1,500,000 people. I again repeat, 1,500,000 people. And they were divided into 2 groups. One group did at least 3 days of 1 hour of aerobic exercises, what you people call resistance training, and 5 days a week minimum walking at the speed which you become little breathless while talking. And the other half, whatever they wanted to do, they did that. 15 cancers. Again, I repeat, 15 cancers. Incidence of them were shown to decrease in the people who did regular exercise. Memorial Sloan Kettering Cancer Hospital, USA, again did a study that while chemotherapy, patients who did yoga 5 days a week, the side effects of chemotherapy was reduced by 49%. Imagine, Darren, yoga was discovered in India, but the Americans latched onto it faster than what we could. There are studies where something called as a prehabilitation, and I'm sure you and Rajat will be absolutely understanding that concept. The people who do prehabilitation for at least 3 weeks before their surgery for cancer, 1 kilometer of walking and 10 times the lung spirometry. The hospital ICU stay was reduced by 2.5 days in the people who were completely prehabilitated. Now, what more evidence do people want? But I'm sure we as human race are lazy people. If I start writing a tablet, which like exercise in the form of the tablet, I'm sure there will be 100% compliance. All patients would say, oh, Dr. Vora has written this tablet. Wow, let's take it. But you won't believe, Darren, and you won't believe, Rajat, that it takes a hell lot of discussion with each and every patient of cancer to undergo exercise program. On this platform, I would again request, plead, force, beg every cancer patient that they should undergo exercise program.
Excellent, Dr. Vora, because we can't emphasize enough, and that's why when we had started that program, that was the whole idea, that how do we educate, encourage these people, right?
Absolutely correct.
Taking it to the next level, whether it be exercise during cancer, but even more, in survivors or people who are yet recovering or are being treated with cancer, myths that are there, misconceptions that are there. What are the things that you'd like to address here?
Rajat, you are asking about the exercise and the myths in survivors, or in general myths in survivors?
Both. So it can be in survivors and patients or otherwise as well. But myths that are there that stop them from actually getting active.
It is not myths, Rajat. It is a pampering. Imagine somebody in the family is diagnosed with cancer. The first thing what the family does is, you don't do anything. You stop doing. We are there to do everything. That is the first thing. The second important thing which happens is, they are as if they are going to die tomorrow. Again, the over pampering happens. During cancer treatment, because the so-called misconception that your immunity goes for a toss, people become inactive, they become sedentary. And imagine, Rajat, if somebody forces you not to exercise for 6 months, apart from antidepressants, which I'm sure you will be taking, you will find it difficult to go back to your routine exercise program. So what happens? A person conquers cancer, but is in a comfort zone of laziness and sedentary lifestyle. Don't do a lot of exercise. You have just been cured of cancer. Just relax, rest yourself, and that further increases the vicious cycle. I would say that every patient of cancer should not do exercise till the last day of their life. Very crystal clear. There is no doubt about it. Even the Supreme Court, even the tribunal, even God comes down and says that this is not true, I'm not going to accept it. Because the evidence after evidence says that whether you are a survivor or whether you are not a survivor, whether you are taking active treatment, exercise helps in each and everything. In fact, first of all, I hate the word survivor. Does anybody ask, are you a tuberculosis survivor? Nobody asks that. So why do you ask, why do you label yourself as cancer survivor? Come on, you have had one disease, it has been cured, move on with your life here and start exercising. In fact, exercise in survivors, so-called survivors, it has been shown that if they do a regular exercise, the chances of relapse reduces by 35%. 1/3 of patients will not relapse if they are active in their lifetime. Do you know any drug which will reduce the relapse rate by 35%? I'm not aware of anything in the literature.
Brilliant.
That's a fantastic message. I think just to touch on a point that you've made, the scientific literature now has tried to put this out a couple of times, but I think it's been met with quite a lot of resistance, that actually the miracle drug has been discovered. A drug which prevents a lot of diseases, it treats a lot of diseases, it has minimal side effects, if no side effects. And that drug is exercise. Yet for some reason, we're still not prescribing it as maybe as best as we can. So what are the challenges, do you think, to prescribing exercise? Why are we not prescribing it as effectively as it needs to be prescribed?
The challenge lies in our minds. Our minds means doctors' minds. Doctors who are treating cancer. I'll ask you, Darren, if you are convinced of something in your family, that it is the best for your family, If you are convinced, you'll be able to convince me. But if you are not convinced yourself, you'll say, oh yeah, okay. Some mad people like Rajat and Dr. Vora keeps talking about exercise. You can do it if you want to do it, but it's okay. That is where we lost out. So each and every doctor, each and every healthcare worker, each and every caregiver, they need to be first convinced of the so-called, what you said, the magic miracle cure without any side effects. There are no side effects. In fact, there are advantages and only advantages of exercise. So I think the first and foremost, the medical fraternity has to put forth that exercise is as important as breathing. It is more important than your surgery. It is more important than your chemotherapy, more important than your radiotherapy. Yes, a word of caution. Exercise alone will not cure the cancer which a patient is suffering from right now. Please do not have the wrong notion. But exercise will help you at each and every step. It's like if one surgeon is performing surgery on you, and if you are doing regular exercise before surgery, you can assume that a team of the most certified and most efficient doctors are performing surgery on you. That much would be the efficacy of the surgery on your cancer. And that much would be the efficacy of chemotherapy on your cancer. The most important challenge is the fear in the mind that during cancer, if I exercise, will anything go wrong? Once we address that, I think every cancer patient will start exercising.
So, we talk about the challenges, the problems. How do we get over, how do we get over these hurdles, if it were?
Rajat, very, very difficult question to answer that. But yes, small change brings revolution. One vote wins election. One bullet wins wars. We all know that. And this is not just for the sake of saying, we all have seen in the history of mankind, one person brings change. So I think somewhere somebody has to start in a very scientific way. People like you who are giving the platform to this Exercise Reduces Cancer program, I would request each and every one of us to broadcast it as much as possible. Every medical conference, I can talk only of cancer, but we all know, be it diabetes, be it heart patient, be it stroke, every medical conference has to talk about exercise, one. And in fact, every medical conference should have one exercise competition for doctors. Once the doctors understand that attending the conference is as compulsory as doing the exercise during conference, other than attending the lectures and giving the didactic lectures or putting yourself on the panel, slowly, people will start realizing the importance of exercise. Second important thing, Rajat, I feel where you and I, both of us, I'm sure you may not be lacking, but I lack and many of the doctors lack is documentation, which we have started doing now in Hope. I'll give you a small example. Chemotherapy causes numbness and the tingling in the hands and feet. There are 137 drugs have been tried. All of them have failed. There are only two things which have shown to improve this. One is regular exercise and second is acupuncture. Now, you're not going to do acupuncture for 2 times a day, right? So, but you can do exercise. And we have started documenting. Once we start documenting, like Rajat, you document that Dr. Vora came 10 days before the marathon with severe muscle spasm. And these are the simple exercises which I told him and he completed his marathon. We start documenting. There's nothing like success story. I preach and preach and preach, but one patient tells that, oh, Dr. Vora's treatment is good, that patient will be sold out to me. So similarly, we have to keep documenting slowly, there would be a change, I'm 100% sure about.
Fantastic. So obviously we're in this period of lockdown at the moment. Are there any recommendations that you could give for everyone to stay as active as possible?
During the lockdown period, very easy. The easiest thing to do is to gain weight. And otherwise also, I think it's easiest to gain weight. I think important point the lockdown has taught us is the family bonding, which I feel each and everyone should enjoy. In that family bonding, one of the important point is to and have some sort of competition amongst each other. It will be very easy to do household tasks. Half of the activity will come from there. The remaining half, I would suggest is every day, at least for 40 minutes, a person should do some exercise. There's a reason. The breathing exercise, for example, increases the opening up of the alveoli of the lungs. It increases the oxygenation. The hypothesis after hypothesis, the studies after studies in corona is coming is that the virus reduces the oxygenation in the body. Whether it has a direct correlation with the exercise or not, but we all know the young active people are suffering less from the major side effects or the major catastrophes of coronavirus. Somehow, the females are less affected than males, 3:1 ratio. Nobody knows why. I can attribute because females are more active in the kitchen and in the house more than males. So maybe this may be an opportunity for all the males to take over the kitchen and the household activities from females. Again, this is a hypothesis. Don't quote me anywhere, but it is worth trying. I would suggest on a serious note, some activity, be it standing, be it sitting, be it breathing exercise. There can be mild, moderate, severe, depending on what type of disease you are suffering from. There are experts like Rajat, there are experts like Afi. They are there, reach out to them, but do some form of activity, some form of exercise during this lockdown period. Your immunity will increase. The chances of you catching infection is less, and even if you catch an infection, the side effects are much less if you continue doing exercise. This is something which is written.
Thank you, Dr. Vora. It was an absolute pleasure having you over on the podcast.
Thank you so much, Darren and Rajat, for inviting me. And I can't again stress the importance of the activity which both of you are doing. I wish all of you and your family members a safe lockdown period. And I wish that all of us remain safe and sound and continue doing the good activity what people are doing. Congratulations to both of you.
Thank you very
so much. Thank you, people, for watching another episode of MoveMint Medicine. And subscribe to our channel to watch others episodes that will be coming forward as well. Thank you, Dr. Vora. Thank you, Darren.
Yeah, hi. So I'll talk to you about a very simple exercise that can be done by anyone and everyone. So this is a respirometer, and it can be done by anyone and everyone. All right. So the idea behind this is it's cheap, easily available at any chemist. What it does is it works with your lungs. Now remember, lungs are right here, and lungs are within the rib cage. So if we talk about the spine, there's 7 vertebrae in the neck, there are 12 in the thoracic region, so the chest region, and then the lumbars have 5 of them. Okay, so there are 24 vertebrae from the neck, base of the neck, up till where the belt level is. 50% of them, so 12 of them, are attached to the ribs. So where the rib cage are, and that's where the lungs are. So if you're working with the lungs, so if you're taking those resistance exercise where lungs are being done, you're moving those ribs. So you're moving 50% of that spine, all right? And you're moving that, the pressure on the neck is lesser, the shoulder pain, if that's there, if the hip pain, the back pain will calm down because you're getting to move those vertebrae, all right? Mobility is crucial. All right, so here's the thing. This is the respirometer, 3 balls it has, the red and the yellow and the blue. Red is the easiest when you're pulling in, so I'll be taking a breath in, and red is the easiest, any of us can. Yellow a little bit more difficult, blue slightly more, right? And it's okay if you can't actually, the very first day, pull all of them up. You'll see what I mean. So what I did there was, I took a deep breath in, all right? So again, I held it there for a couple of seconds, then I let it go. Cancer patients, everyone should be doing it. Chronic diseases, diabetics, non-diabetics, other chronic diseases, everyone should be doing this simple exercise. You take it up, hold it there, the balls for 2 seconds. Doesn't matter if all 3 or only just 1 or 2, whichever number of balls that go there. Hold it there for 2 seconds, as I said. Start maybe with 5 reps. I like maybe 10. Gradually keep building it up. Maybe if you can only do the red over a week, 2 weeks, try pushing harder for the yellow to go up, the blue to go up. Once you've done all three, then you go to the next level. Then you try doing 10 repetitions, and throughout the 10 reps, all three balls or two, you're trying to raise them up. Okay, do 10 reps, do 5 reps, whatever that number be. Try to do it over 5 times a day. Okay, you will be surprised how that lung function, the lung capacity that being improving is helping the muscles, as I'm talking about, the muscular pain, but it's also helping chronic diseases. We know now that coronavirus, when patients are there who are affected by it, how lungs, if they are stronger, the lung, the oxygen carrying capacity, all that stuff does matter. You're improving it. It isn't foolproof, but you'll have a better chance. So for whatever reason, if you're a runner, you should need to be doing it. You're a sports person, you need to be doing it. So it's a very, very good, simple exercise that should be done. All right. Most people, when they're running, they aren't using the lungs enough. This is helping them learn how much more the lungs can be working. So even people who've been running for 10 years, they get surprised when they do this. All right. Because when you're running, how much lungs capacity is being used by you. This will improve it. So please, please, please has to be done. So again, like this, you take a deep breath in and you bring it down. And you bring it down. Obviously, it should be on a table. And then you reverse it. This also should be done by everyone. Now I have to exhale. Okay, this is a little tougher for me. I haven't been practicing this at all. So you'll notice the blue will probably not even move. All right. So in this, what is happening is the focus is on breathing out. So I'm exhaling. I hold that breath for a couple of seconds there. And then while I go, then the balls go down. So you repeat that a few times, maybe start with 5 repetitions, 5 sets a day, and suddenly your lungs are getting moving, and that's a very good exercise. Okay, so simple exercise should be done by everyone.